So I chose to become an eye surgeon because I love helping people see better. And when I was in medical school, I spent time in Africa and I saw the miracle of cataract surgery. I saw people that were blind before that could, through a simple, inexpensive surgery, have their cataract removed and their sight restored. So one of the reasons I moved to Southern Oregon was the opportunity to work with a group of like-minded individuals that love to help people see better. And myself and many of the partners spend a lot of time working not only in our community on blindness projects, but internationally. And I spend about 6 weeks a year working primarily in the Horn of Africa with a nonprofit called Cure Blindness, in which we teach doctors how to do cataract surgery and provide them with equipment and training so that not only the people in the United States get to benefit from the miracle of cataract surgery, but the 20 million people that are blind in the world also have access to a surgery that can restore their sight.